All right, this is my wonderful patient, and she had a really bad problem. We did a very big surgery on her, one that worries me. Every time I do it, I wonder how well people are going to do. She had a 3-level fusion. That means we had to work on 3 levels in her low lumbar spine, 8 screws, 3 cages, the kind of stuff that sort of scares everybody, even the surgeon a little bit, because you never know how things are going to turn out. And she is now 6 weeks out from surgery, and I cannot believe it's only been 6 weeks because she is doing amazing, and I'm going to let her tell the story for herself.
When I first came to Dr. Sani with a lot of back pain, I was running 7 to 9 most of the time. Pain and numbness down my right leg. We tried different things, less invasive things, and even did a spinal stimulator, and that worked for a little while, and then it stopped working, so we finally went for the surgery, and I'm extremely happy. I feel a lot better.
How's the pain in your leg, the right leg?
It's gone.
Gone, completely gone at 6 weeks,
Yeah.
which is unbelievable because you had. How long did you have pain before all that? Before we did surgery?
Years.
I mean, because really, I think honestly, if we're going to be honest now, it's probably me that was fighting against surgery more than you, right? I mean, I felt like I was constantly trying to talk you out of it, telling you, oh, it's gonna, it's too much surgery and this, that, and the other, and that's why we tried the stimulator. So I would say, if anything, I was the roadblock. I mean, not out of malice, but just out of concern of being a big surgery. And oftentimes, when someone has a big surgery like that, their back pain. People say, oh, I know people who had surgery like this and, they got worse or they never got better, and certainly not better at 6 weeks. But you'd say your back pain is now down to
Usually running about a 4.
But a 4.
Now and then it'll spike up a little bit.
Okay, so we at least cut it in half. And that's what I tell people. If I cut your back pain in half, I consider that a success. And at 6 weeks, it's very possible that you're going to even go way lower than that. But we'll see. I mean, we'll see.
Great.
Yeah. But you're happy you did it.
Oh, yes.
And you would do it again.
Yeah.
Pretty tough the first. So what the hesitation there is the immediate post. Yeah, that's brutal. Right. We're talking, guys, about. I'm not going to show you her incision. Her incision looks amazing. It looks really good. But it's a pretty long incision. It's a big surgery, and I don't care who you are. This hurts, right?
Oh yes.
Yeah.
Yes.
And we do our best to control pain in the postoperative period. When do you think you got out of that zone? 2 weeks, or when did you get out of that zone? Because it's only been 6, so. The zone of being like, this is horrible. 3 days, 2 weeks?
Oh gosh, 3 to 4 weeks, yeah.
3 to 4 weeks. Okay, so you really just turned the corner and are feeling a lot better now.
Yeah.
The leg pain was gone, but the back was really sore.
Yes.
Well, your x-rays look great. Your wound looks great. You look like you're doing awesome. This is a big surgery. There's no way around it. She did wonderful. I do not expect every patient to do as well as you have, unfortunately. I wish I'd be lying. And the thing about lying to people about this kind of thing is they know when they wake up that you're a liar. So I don't even consider it. And how long were you a patient here before we finally made the decision to do surgery?
Oh.
At least 4 years.
Yeah, 4 years, guys. So these are decisions that I do not take lightly. I do not push on my patients lightly. We don't use generally unless it's true, and it's only true in a handful of patients that I can think of. I don't say if you don't have surgery, you're going to be paralyzed. I hear these kind of things all the time from patients. Some surgeon told them they're going to be paralyzed if they didn't have surgery. That's occasionally true, but it's usually not. The decision to do surgery is because you can't live with the pain. And in my opinion, I tell patients this all the time, if the doctor's having to scare you or talk you into having surgery, unless you're so weak you're in a wheelchair, and you can't control your bowel or bladder, then really, then of course you need surgery in those cases, in many cases. But if it's just pain, it's really your decision. You're the one that finally decides, you should be telling me I can't take this anymore. And that's what we do surgery. And that's what we got, right?
Yeah.
We got to the point where you're like, look, I'm willing to take the risk. I can't take this anymore. 4 years as a patient before we took that leap, but super happy that you're doing. I'm saying I am, and I know you are, and I'm super happy that you're doing this well, and we're hopefully going to be able to keep you in this situation. But very happy. Thank you so much for sharing that.
Well, thank you for finally doing the surgery.
Awesome. Happy Memorial Day, everyone.